Since its beginning in 1949, the Mental Health Center has been owned and operated by the community. In fact, after she retired in 1980, Dr. Vera French agreed to let the center use her name as long as we kept the word community in the name of the center. That was to help us to always remember who we are serving and to whom we are accountable. That commitment to community has helped us to keep our focus all these years and provides direction going forward into the future. Since ancient times, people all over the world have struggled to understand and treat mental illness. Here to provide the context of how far evidence-based treatment methods have come is Dr. John Stecker, Medical Director and Psychiatrist for Vera French Community Mental Health Center.
The study and treatment of mental illness dates back to the 3rd century BCE in India, where some of the first textbooks and hospitals for mental illness were established. While there were some minor advances in understanding and treating mental illness over the next 2,000 years, many interventions were based more on superstition and fear than on achieving effective outcomes. Practices like lobotomy, restraints, exorcism, and fever therapy were unfortunately used with no scientific evidence to back them. It was not until the 20th century when a more scientific approach to looking at mental disorders was introduced. Psychopharmacology, or the use of medications to treat mental health conditions, first began in the 1800s with the use of anesthesia and bromides to treat pain and sleep. The next big discovery was in 1935 with the development of stimulants, which were used to treat depression and eventually ADHD. The most dramatic breakthrough, however, occurred in the late 40s to early 50s with the synthesis of lithium and thorazine, which were used to treat mania and psychosis. Soon after, scientists discovered the antidepressants and benzodiazepines. All of these brought great relief and a new outlook on life for many individuals suffering from mental health disorders.
For the reasons Dr. Stecker mentioned, the 20th century saw the most rapid advancement of our understanding and ability to treat mental illness. Here to tell you about our agency's founding is Chris McCormick-Priest, Advanced Registered Nurse Practitioner and Retired Clinical Director at Vera French.
In 1949, there was a mental health clinic that opened in downtown Davenport that has become the seed or the beginning of what we now know as the Vera French Community Mental Health Center. It began as the Scott County Mental Health Clinic and grew over the years. It wasn't until after the 1963 Community Mental Health Center Act that the Vera French Community Mental Health Center, as we now know it, really came into being. After that legislation was passed, Dr. French was very passionate about the community piece of it and was able to convince many individuals in this community about the necessity of delivering an organized system of care for mental health. So with many of her colleagues in medicine and with the Board of Supervisors, a process was begun to make a commitment to apply for that federal aid. In doing so, we were able then to start the development of building this building and bringing the community into the creation of the Scott County Community Mental Health Center. We knew that it would be a long journey, but it was important to us to be able to be based in the community, to be transparent in what we were able to offer, and to be accessible to individuals who lived here. Those were the dreams of Dr. French. So through her hard work and through the work of many volunteers in this community, $405,000 was raised and then matched by federal funds. This building then was built on property originally owned by Mercy Hospital. After the building was completed and staff moved here, we were able at that point to offer the services that were part of the federal legislation. Outpatient services, inpatient services in collaboration with Mercy Hospital, partial hospital, which was a 5-day-a-week program, anywhere from 4 to 6 hours a day, emergency services, which meant our doors were open to individuals whenever they needed our service, and we were available 24/7. And finally, consultation and education, which was the arm of prevention that was so important in the identification of how we need to work towards improving the mental health of individuals in our community. In appreciation for her years of work in mental health, in 1982, 2 years after she retired, the Vera French Board of Directors, with great community support, moved forward and renamed the Scott County Community Mental Health Center the Vera French Community Mental Health Center in recognition of Dr. French. And it's that name that we carry now and into the future with us to continue to provide services in the community.
In the 1960s, Dr. Vera French came to the Scott County Mental Health Center as a staff psychiatrist. By 1968, Dr. French was our agency's executive director. We are so fortunate to have audio of Dr. French reflecting on our agency's first building in downtown Davenport.
I started in the Schmidt building where the elevator didn't work, and I remember the day that the pigeons got in. They were always sitting on the window ledges, and it was a building that I grieved over, not because I couldn't walk up 5 flights in those days, and not because of the pigeons, but because of the image it presented. This is the best that we have to offer for people with mental problems. And so after we abandoned the pigeons, we went to the lower level of the Professional Arts Building. It was small space because it was lower level, but it was new and it was in the context of people well-trained doing good work. We believed in this expanded mental health center, and we could do it. Concurrently, the nursing program that had occupied Marion Hall ceased to be moved to Marycrest College, and we at the center had the opportunity to house the increased staff that we were working toward in temporary facility at Marion Hall we made available to the community.
Dr. French retired from the Scott County Mental Health Center in 1980. In 1982, the Board of Directors voted to rename the agency in her honor. Dr. French agreed, but only if the word community was part of our name. Here to tell you about our expansion in the 1980s and 1990s is Denise Bank, Chief Operating Officer of the Vera French Community Mental Health Center, Nathan Songaroth, Executive Director of the Vera French Foundation, and Stacy Kaiser-Willie, Executive Director of Vera French Housing.
In the 1970s, deinstitutionalization occurred, which meant that people who had been served in large congregate settings were now sent back to their local communities to be with families, neighbors, friends, and areas they were familiar with. However, this brought some challenges as well because community-based systems had not yet been developed to meet the needs, so many people ended up in jails, homeless, or in hospitals being served. In 1987, Vera French partnered with Scott County to take over management of Pine Knoll Residential Facility, which was a 60-bed facility for adults with chronic and persistent mental illness. And this program continued for many decades until 2017, when the program had gradually over time developed 7 group homes, as well as 2 15-bed residential care facilities to serve people of Pine Knoll and also other people that may be in need of the service, until a lesser step-down service would be appropriate.
In 1985, the Vera French Community Mental Health Center Board of Directors established the Vera French Foundation. This was following a larger trend in healthcare philanthropy, which was really designed to help standardize and professionalize how generous gifts from the community could support our agency. The foundation was created with the mission to identify and develop multiple sources of funding in order to support the goals of the center. Throughout the 1980s and 90s, the Vera French Foundation was that vehicle by which gifts could flow in from the community, but during that time period didn't have any staff. In spring 1997, the Vera French Foundation launched its first capital campaign. Known as Building a Healthy Community, the campaign raised over $900,000 in the context of celebrating the agency's 50th anniversary in 1999. Also, as part of that successful campaign, the Vera French Foundation was able to hire its first executive director, also in 1999. That position continues to this day, and it is one that I am proud to hold. Today, the Vera French Foundation works very closely with its volunteers to spread compassionate awareness of mental illness in our community and to inspire generous giving. Our work supports both the Vera French Community Mental Health Center and Vera French Housing.
Housing is an important social determinant of health. The lack of housing or good quality housing negatively impacts a person's physical and mental well-being. The Vera French Housing Corporation was formed in 1994 to address the community shortage of affordable housing for persons with disabilities. Vera French Housing provides scattered site, permanent supportive housing across Davenport and Bettendorf. between multiplex units, duplexes, and staffed habilitation homes from Vera French Community Mental Health Center. The tenants living in Vera French housing can choose from an array of services from Vera French Community Mental Health Center or within our Quad Cities community. Vera French Housing is passionate about providing good quality, affordable housing. Our average length of tenancy is 10 to 15 years, with many of our tenants living in Vera French housing for over 20 years. Housing is a person's stability. We want to provide, and we do provide, more than just a roof over someone's head. Vera French Housing helps a vulnerable population in the Quad Cities community not only live, but thrive.
Also in the early 90s, Vera French developed the Frontier program, which was a day program for people who lived out in the community to come into to get supports and services. And staff also did some outreach into the homes as well. And this program continues until this day, and in 2013 was renamed the Carroll Center after a longtime client who utilized the program. In the early 2000s, Vera French continued to grow and expand community-based services, including partnering with the Davenport schools, as well as taking over Rick's House of Hope, which is a program for grieving and traumatized youth, providing groups and working in conjunction with the YMCA to do therapeutic summer camps. Vera French continues to grow and innovate with different evidence-based service lines, working together with our community partners to solve big community problems.
We know from the research that good mental health is much more than therapy and medicine, that it involves safe and affordable housing, steady employment, balanced nutrition, regular exercise, healthy social connections, and emotional and spiritual supports. As we look to the future, our integration with these social determinants of health must be intentional and increasingly a part of everything we do to improve healthy outcomes and the overall health of our community. Meeting people where they are, making our services more accessible, reaching underserved and under-resourced individuals and families, and bringing to the community evidence-based services that are proven to work. These are all ways that we make a real difference every day. Helping to solve big community problems is our primary purpose, and the real reason the Community Mental Health Center, Housing, and Foundation were born all those years ago. We are Vera French.